Hello, welcome to my channel. Subscribe or like if you like. Today we are going to talk about the active principle clorazepate. We will explain its mechanism of action, its side effects, its dosage, its uses, its contraindications, its warnings, pregnancy and indications. The trade names of clorazepate dipotassium are Tranxene T-Tab, Tranxene SD, tranxilium. Mechanism of action of clorazepate. Specific agonist on the central receptor that is part of the GABA-omega macromolecular receptors complex that modulates the opening of the chlorinated channel. What is clorazepate used for? The therapeutic indications and posology of clorazepate of potassium are: injectable, adults. States of psychomotor agitation, confusion or aggression, intramuscular or intravenous, 20 to 200 mg per day, followed by oral therapy. Pre-medications, intramuscular, half an hour or 1 hour before surgery, or intravenous, half an hour or 1.5 hours before surgery, 20 to 50 mg per day. Alcoholism, pre-delirium, delirium tremens, 50 to 100 mg every 3 or 4 hours, decrease by half after 2 or 3 days. After 5 days administer orally 150 to 300 mg per day. Tetanus, intravenous infusion. Benign, does not require tracheotomy: 120 to 500 mg per day. Malignant, requires tracheotomy and assisted ventilation, 500 to 2000 mg per day. Oral, duration as short as possible. Reassess at regular intervals, including need to continue. Do not exceed 8 to 12 weeks, anxiety, and 4 weeks, insomnia, including gradual withdrawal. Start with the lowest recommended dose. Do not exceed maximum dose. Adults. Anxiety states, isolated or associated with an organic condition, with or without insomnia. Depressive states with anxious component, both essential and reactive. Behavioral disorders due to anxiety, insomnia, nocturnal anxiety, awakening anxiety, neurovegetative dystonias of diverse location and moderate intensity, anxiety linked to the prescription of a surgical intervention, second post-traumatic syndrome, 5 to 30 mg per day, fractioned or in one dose. Anxiety, phobic and obsessive neuroses, anxiety depressive states, anxiety and psychosis, chronic alcoholism, detoxification cures and drug or alcoholic detoxification, severe neurovegetative dystonia, outpatient, 25 to 100 mg per day, inpatient this dose is significantly increased, and even doubled. In overacute situations and under control, 400 to 500 mg per day. Introduce treatment in a gradually increasing manner. Elderly, renal insufficiency, hepatic insufficiency, decreased dose, recommended half of the average indicated dose. Children. Psychic and somatic manifestations of daytime anxiety. Alterations of the character. Alterations of the dream. Psychosomatic alterations. Infantile bronchial asthma, average dose, half a mg/kg per day. Minimum, 0, 2 mg/kg per day. Maximum, 1 to 2 mg/kg per day. Total daily dose can be distributed in 1 to 3 doses. Mode of administration of clorazepate of potassium. Oral route. Envelopes, once a day, dissolved, administer immediately, do not save for later use. Contraindications to clorazepate. Chlordiazepoxide or benzodiazepine hypersensitivity, children, except pediatric formulation, myasthenia gravis, sleep apnea syndrome, severe respiratory failure, decompensated respiratory failure, severe liver failure. Warnings and precautions with clorazepate. Elderly, renal failure, mild or moderate liver failure, chronic respiratory failure, myasthenia, exceptionally and with monitoring, alcohol or drug dependency. Risk of antegrade amnesia, psychiatric and paradoxical reactions. Risk of tolerance, after continued use, dependence, physical and psychological. Abrupt interruption after continued use causes withdrawal syndrome. Do not use an anxiety plus depression, or as primary treatment in psychotic illness. Liver failure and clorazepate of potassium. Contraindicated in severe liver failure due to associated risk of encephalopathy. Caution in hepatic insufficiency, decreased dose, recommended half of average dose indicated. Renal insufficiency and clorazepate of potassium. Caution, reduced dose. Interactions with clorazepate of potassium. Additive synergy with healers, myorelaxants. Sedative effect enhanced by alcohol, avoid cisapride. Enhancement of CNS depressant effect with neuroleptics, hypnotics, anxiolytics/sedatives, antidepressants, opiates, antiepileptics, sedative anesthetics and antihistamines, other tranquilizers other than benzodiazepines, morphine derivatives, barbiturates, clonidine and related substances, for example methyldopa, guanfacine, moxonidine. Activity enhanced by liver enzyme inhibitors, cytochrome P450. Risk of collapse with cardiac and/or respiratory arrest increased by clozapine. Pregnancy and potassium clorazepate. In humans, the teratogenic risk, if any, is probably low. In epidemiological studies, a teratogenic effect has been suggested for certain benzodiazepines but is not confirmed, so it is best to avoid prescribing dipotassium chlorodiazepoxide especially during the first trimester of pregnancy. If the product is prescribed to a woman who might become pregnant during treatment, it is recommended that when planning a pregnancy or detecting that she is pregnant, she should contact her physician to proceed with withdrawal of treatment. If, due to strict medical requirements, the product is administered during a late stage of pregnancy, or at high doses during delivery, it is foreseeable that effects on the newborn baby such as hypothermia, hypotonia and moderate respiratory depression may occur. Children born to mothers who take benzodiazepines chronically during the last period of pregnancy may develop physical dependence, and a withdrawal syndrome may be triggered in the postnatal period as irritability or difficulty with feeding, lactation and potassium clorazepate. Because benzodiazepines are excreted in breast milk, their use is contraindicated in nursing mothers. Effects on driving ability with potassium chlorodiazepoxide. Chlorodiazepoxide, depending on dose and individual sensitivity, may decrease attention, alter responsiveness, and cause drowsiness, amnesia, or sedation, especially at the beginning of treatment or after an increase in dose. It is not advisable to drive vehicles or operate machinery whose use requires special attention or concentration, until it is proven that the ability to perform these activities is not affected. Side effects and adverse reactions of clorazepate of potassium. Bradypsychic response, withdrawal syndrome, drowsiness, depression, anterograde amnesia, dizziness, muscle hypotonia, asthenia, fatigue. Development of dependence. Potassium clorazepate overdose. Flumazenil antidote.